In today's health headlines, are women better doctors than men? A new study claims COVID lingers in your blood for months. Is that true? And how social media can help you eat healthier. Joining me is Dr. F. Perry Wilson, Associate Professor at Yale School of Medicine, Yale Medicine physician. Welcome.
Thanks for having me.
All right, first off, researchers looked at hospital mortality and readmission rates to compare whether male or female doctors had better outcomes. What do we know about that?
Really fascinating study, and I think I'm married to a female doctor, and so I can say, anecdotally, yes, they are better than male doctors. But let me tell you how this study worked. This was a study of Medicare patients admitted to the hospital who were treated by a hospitalist. And which hospitalist you get is kind of random. You don't get to choose who your hospitalist is, which means some were male and some were female. Now, for male patients, the sex of the doctor didn't matter very much. But for female patients, they actually had a slightly lower 30-day mortality, death rate at 30 days, if their doctor was female. It was a very small amount, but it was statistically significant, and it leads to a number of really interesting questions. Why might female physicians be better when they're caring for female patients? And there's some data to suggest that one example might be that they're less likely to dismiss some concerns that the patients have, and I think maybe some male physicians could learn from that.
We know how to multitask.
That's also true.
All right, a recent study claims that COVID-19 persists in the blood for months after infection, but the results are not quite that clear. What do we know?
Yeah, I am a little worried about this one because you're seeing a lot of takes on this in the media. This is a study in the journal The Lancet, one of the preeminent medical journals, which looked at the persistence of parts of the COVID virus proteins in the blood up to 14 months after infection. And what it found is that in about 1 in 4 people with confirmed infection, these proteins were still there 3 to 6 months later. But what I'm a little bit worried about is people interpreting that as to mean the infection was persisting. Proteins from the virus, like the spike protein, is not the same as being infected with the virus, and we don't really know what the long-term impact of having some of these proteins floating around in your blood is. Future studies will have to look at the link to long COVID, for example. I also want to point out that this study was done on blood samples taken prior to vaccination becoming available, and so this is not a study that suggests anything about vaccine status or vaccination. This is about COVID infection.
All right, and finally, people who follow social media accounts that share healthy eating are more likely to increase their own consumption of these foods. Tell me more.
I always like easy ways to live better. There aren't too many of them. This was a small study, but it was kind of interesting. They took 50 or so college students and had half of them subscribe on Instagram to a bunch of these healthy eating types of accounts, and the other half at random was assigned to follow interior decorating accounts, as a control condition. And what they found is that the people assigned to follow the healthy eating accounts ate about 1.5 more servings of healthy foods a day and about 1 less serving of unhealthy foods a day over the follow-up period. And that's pretty good. If those changes persist, that can lead to a lot healthier diet. So maybe there's an easy way to get inspired to eat healthy.
And that's what you call an influencer.
There you go.
Dr. F. Perry Wilson, thanks so much. Have a great day.